Hello and welcome to In the State House, this edition of In the State House with our guest Representative Michael Day and Senator Jason Lewis. My name is Alan Macdonald and we're going to have a chance to talk with Senator Lewis and Representative Day about a very, very active 2016. We're here at the end of the year and a lot of the things that will be coming up for discussion in the state legislature in 2017. Gentlemen, welcome.
Thanks, Alan. Great to be back.
Great to be back. Representative Day, congratulations on your re-election.
Thank you very much.
Much
appreciated.
And Senator Lewis, the same for you. Congratulations on a re-election.
Thank you.
Two gentlemen had a very busy year on the issues we'll talk about, but on campaigning as well. And I think that the audience that we have will be interested in how you envisioned the last year, including all of what you heard from the voters as you were actively out, because I know you were all through the year.
Thank you, Alan, and good to be back with Representative Day. And it's good to have the election behind us now and focus on getting back to work.
This is true. Now, you're still chairing the Public Health Committee in the Senate. If I have been reading my news releases well, and some other committees as well, but let me talk about that a little bit, and then with Representative Day about the committees that you're on and leading. Healthcare, there's so much going on, and of course the concern, we just talked about elections, at the national level is the future of the what we would call the ADA, I guess, but the full coverage for everybody in the country, which we've been able to do in Massachusetts, but hasn't met as much success in the acceptance at the national level. Do you see any changes coming or things that you'll be working on?
We are quite worried, actually, for a couple of reasons. You know, we're not worried in terms of whether we would lose protections that many Massachusetts residents have come to depend on, things like coverage, you know, for pre-existing conditions or no caps on your coverage, because we had that in Massachusetts, of course, before that was put in place nationally. But what we are worried about is that, you know, we do depend on a lot of federal dollars to help cover our, particularly our Medicaid costs, Mass Health, and we just negotiated. The Governor Baker and his administration just finished negotiating a new 5-year waiver, it's called, which basically gives us some more flexibility in how we run our Mass Health program, and we're doing some innovative things actually to try to improve the quality of care and reduce cost. But part of that waiver was also being guaranteed a certain amount of federal money that we can count on over the next 5 years. If the new administration decides to, you know, make changes to that waiver or in other ways cut back their funding for the states, for the Mass Health program, that could be pretty devastating impact on our state budget. And it's very uncertain right now, and we're waiting to see, but we're concerned about that.
Representative Day, was that something you heard about on the campaign trail when you were out this year? Were people tuned in to what was going on the healthcare front?
Not so much on the what we're now talking about, what's being discussed nationally, which is the repeal of the Affordable Care Act. That wasn't really on the doors locally. I don't think, frankly, many people envisioned us having that discussion at this stage. Certainly not in this area. So that was a bit of a curveball coming out. But I echo Senator Lewis's concerns that 5-year waiver, if it is in jeopardy with the new administration, we're in some difficult times ahead in Massachusetts, particularly on the budget front, of where we're going, where the cuts would have to come, because those are significant dollars at stake.
Well, let's talk a little bit about some of the local issues as we, we're going to worry about the national for sure, but I know you've both been very active on the transportation issues. So we've had a real serious look at the MBTA functions, and we're talking about scheduling changes and maintenance and equipment buys, and I know you've both been very busy on our commuter rail station for Winchester. That's big on our minds for sure.
Yeah, that's progressing, which is great. We just reached the 30% design stage, so that's on track. Excuse me. We had secured last year the $31 million, I think it was, funding in the 5-year capital improvement plan for the MBTA. So that progresses, which is great. We're finally getting to get this redesigned. And I think it's really going to transform our downtown here in Winchester. Senator Lewis and I and Senator Jalen have been on a citizens panel for lack of a better term, a small subcommittee that's handling the initial design phases and working with the T to come up with an attractive design for that station. We've got some, obviously good news, I think, on the T front, where the Carmen's Union just negotiated a longer-term deal with the T, so that the labor issues aren't going to be front and center. There was I think it was an $80 million savings they realized from that new 5-year deal. So some stability there and some longer horizons for us to be able to plan properly and start to really put the money to good use on the infrastructure front.
It was definitely a positive editorial in the Boston Globe on the Carmen's Union negotiation on this with the MBTA.
They may want to frame that. They don't get those too
say,
often.
that's a step in the right direction for sure, because that's not the norm.
Yeah, it was good to see that. And the other thing I will add, in addition to the rebuilding of the Winchester Center commuter rail station, which of course is so important to Winchester's transportation and I would argue economic future, we continue to be very concerned about just the reliability of the commuter rail and continue to get feedback from residents of Winchester and the rest of my district about poor performance on the Lowell line. And I met recently with the new general manager of Keolis, which operates the commuter rail for the MBTA, and I was very impressed with him. He has an extensive rail background. I was brought in specially from the UK actually to manage Keolis, and he walked me through all the steps that they've taken or will be taking to improve their maintenance, to improve the operations, to be ready for the winter, we'll see. But I'm cautiously optimistic that we will see improvements in the service quality and reliability and the on-time performance in the months ahead, and hopefully that'll bear out even if we have a tough winter again.
Well, to me, for this area, certainly for the town of Winchester, but for this whole area, as Boston grows, and we see a lot of activity in the inner city and in the greater Boston area, I know driving in and out occasionally to the city, public transportation, commuter rail, and other is going to be even more important as our economy grows. That's a big piece of it, if we can get people around in public transportation.
It also helps, as Senator Lewis said, the economy. It helps attract families to Winchester, which hasn't been an issue, but it's going to continue to improve the values around here and the desirability of this town.
And building more mixed-use development in the downtown, which is our plan, so we'd have more housing there and support the local businesses and restaurants and other, having the commuter rail station right there is a huge attraction.
We've both been active in the housing situation as we've tried to design diversity in our stock, in our housing stock, and I know we've had a lot of discussion on 40B housing, but you talk a little bit about the work you've been doing in the legislature to help communities with the kinds of planning that we need to do.
Well, I think the first thing we should say is that we have both joined with the selectmen and the planning board, the residents, in really opposing ill-conceived housing projects like the one that's been proposed up in Forest Ridge on the Stoneham line. Projects like that, which are massively oversized, in an area which would have poor entrance and egress, no public transportation, wetlands issues. Those are not the right ways to develop housing. So fortunately, that's on hold right now, and we're very hopeful that that will change dramatically or go away entirely. But the fact remains, we do need to build more housing, and particularly more affordable housing, in this region, and Winchester does have to do its part. So I think there is a conversation that's now really more active in the town, and I know the selectmen are taking this on, and the Housing Partnership Board. And there are opportunities, to, I think, expand housing, market rate and affordable, but just do it on a smaller scale, particularly in the downtown area. And we want to be supportive at the state level as much as we can, whether it's incentives through zoning like 40R, which is a good program, or other ways that we can support those efforts. More of a carrot approach than a stick approach.
Yeah. I couldn't agree more. 40B is really that stick, right? It's the state saying, you don't do it, we're going to allow somebody to come in and go override your local rules. 40R is a great example of where we want to go with housing. Winchester certainly needs to develop more affordable housing. And the goal, at least on our end, I think, speaking for Senator Lewis, is to redevelop and reuse as opposed to what you're looking up at Forest Ridge, taking mature forest out of there in a very bad area, environmentally as well as safety-wise. Turn that focus back to existing areas that can be redeveloped. Brownfields, which we don't have too many of in Winchester, a few do exist. Former industrial areas, redevelop those and repurpose those into mixed-use affordable housing. I think is really the way to go. And 40R, as Senator Lewis said, is a focus of mine to increase the funding, the state incentives provided to local municipalities as well as developers to work together cooperatively and bring more affordable housing home.
And it would seem to me there could be an opportunity for more regional help from the state policy on this. You've been very active helping from the town of Stoneham as well as Winchester on that particular project, I know.
Yeah.
And that's a real key. The infrastructure that you know, more so than other years, it seems to me, transportation, housing, and energy even. You've been active in the discussions about the Eversource idea about how to help the region with energy, but how it might affect a community like Winchester at the same time. That's a big issue.
Yeah, and I think on Eversource, I mean, this goes back to, I think, kind of, again, what is an outdated mode of regulation, right? Of just, well, it needs it, so we're just going to ram it through no matter what the consequences are on the local end. And Senator Lewis and I had, in response to what's happening with Eversource, filed legislation earlier this year that would open up this law that says the FSB has to look at the bottom line, the bottom financial line, and if there's a need for more electricity supply, then they're going to go in with the cheapest route. That's kind of been the default of what the FSB, the Energy Facility Siting Board, has been looking at. The legislation we're proposing and we'll be refiling, and I think getting good partnership around the state. When we spoke to other legislators, they were really interested in it because it's coming their way as well. That would require the FSB to look at local consequences as well, to take into account the health and environment and safety considerations of the residents in that proposed line. So.
Right. I mean, we understand that we need to maintain a modern infrastructure, whether that's roads or sewers or the electric grid.
Yep.
But we have to do it in a thoughtful way, and we have to take into account the environmental impact, the health impacts, the impacts on the residents in that neighborhood where they, you know, and you can't just be the lowest cost way to do it is to go from point A to point B, regardless of what we go through to get there. And so we've got to, you know, because our communities are pretty built out at this point. It's not a lot of, you know, empty land to be repurposed. So that's important. Then another piece of legislation that we're working on together that we're going to file, which also came out of this Eversource project that the town of Winchester has been dealing with, is we recognize that it's very costly on the community because the town has to hire, you know, consultants and technical experts to advise the town on how to deal with projects like the Eversource one or other big infrastructure projects, whereas the utility can basically, you know, just pass those costs through to its ratepayers. So what we're going to propose is that reasonable costs that towns and cities have to incur in evaluating projects and working with, you know, utilities, they can be reimbursed for those.
Okay.
Even the ledger a little bit.
We're hopeful that will be. We're going to try to move that forward as probably as part of a bigger energy bill in the next session.
Yeah, I think one of the keys to the first piece of legislation that we're going to try to push through too is that this isn't just going to impact the FSB. Eversource, for example, is going to see what the FSB is going to examine, and then the goal is, and I think what would happen is if we can get this through, they'll work cooperatively with the residents ahead of time so that by the time it gets to the FSB, they've addressed a lot of these health considerations, a lot of these environmental and safety issues beforehand to make it a better project to the extent that it has to come down a certain road.
It's impressive to me, the range of subjects that you get involved in, and it's never ending. I mean, I can think of how important those three issues are that we've just talked about, but then you're dealing also with education issues, mental health issues. But if I could talk a little bit, because education, we've been having education reform for a lot of years, and to me it's working pretty well because, again, the Massachusetts public students, public high school and elementary and junior high students came out very high in the national exam, even in the international category. So the work that you folks are doing to lay the groundwork is impressive. But I know this last year there was some more activity on that.
Well, and I think the important thing is we can never be complacent.
Right.
You know, because the expectations for our students and for the economy is, you know, keeps the bar keeps getting raised. You know, what's expected of our students graduating today is very different from what was expected in years past. So we have strong schools, but we have to keep getting better, and I think we have to continue to work to provide you know, every child with access to a quality education. Part of that is updating the school funding formula, which is a high priority for you know, for both of us, and we're making progress on that. And I'm actually hopeful that maybe something good can come out of the very contentious ballot fight that we had over question 2, which dealt with charter schools.
Yes.
I'm hopeful that, and in fact, the governor and some of our legislative leaders have been already indicating that, you know, that ballot question was really, regardless of how you felt about it, was focused on a relatively small number of students who might possibly benefit. What we really need to talk about is all of our students, and how do we make sure that all of them are, and our public school system in general is getting continually getting better, and we're working to strengthen it through, you know, whether it's technology, social emotional learning, professional development for our teachers, being able to recruit and retain the best possible talent, covering costs like special education and healthcare. So I'm very hopeful that the discussion in the legislature going forward will be broader and not just focused on charter schools.
Yeah, if we stop reforming, we're in trouble. So education reform never ends.
Well, that's a great point.
Right.
And I think the reforms have been going on for a long time, but the early years on the current cycle had more to do with all the students, every child a winner was the famous Jack Rennie paper on that. But it really did, through the support of the legislature, fund the public school programs. And then the next wave, seemed to me, was the, again, infrastructure, the school building authority coming in and helping us get facilities that make a big difference, make a difference in recruiting teachers into the profession, and making students more excited about where they're doing their studying.
Yeah, I don't think you have to look any farther than Winchester High School. That facility, the 2/3 of it that's completed, is just stunning when you walk through, and you can kind of see the excitement with the kids when they get into those new areas, especially in the technological side of things. I mean, it's really incredible some of the facilities they have at the high school level now, and it's preparing them to go out and actually compete globally, which is
That
fantastic.
project's been, I must shout out to the management of that project from the town, and it's on time. I think it's on or under budget. A very complicated project, essentially rebuilding the school in place while the students, my daughter's been there the entire time, and I ask her sometimes, you know, is it getting in the way of your school work, or you know, they've done such a great job managing the project, and also being able to benefit from the new spaces as they are completed.
Right. No, it's going to be a great asset to the community, of course, and there's so much happening. Let me ask, because I'm thinking of the work that you've been doing in the mental health area too. Tremendous amount, and I've seen both of you talking about where we are on helping physicians and public safety people understand the drug situation, the opioid situation, the community policing. But I'd love you to talk a little bit, as the people who are watching, who we all know folks who are struggling with these issues. And it's a difficult situation for the healthcare community, for the public safety community, and for the public officials who are trying so hard to have policies that will help people who need the help. But you're in the middle of it, I know.
Yeah, and I'm fortunate to sit on the Mental Health and Substance Abuse Committee in the House and the Senate, the Joint Committee. And we had some great strides made on the substance abuse front last year, and that we're certainly going to build on that going forward to start really walking back what's going on with the opioids right now. But as that committee is properly named, it goes hand in hand with mental health. And for way too long, we've regressed in mental health here in the Commonwealth. We've got a real issue with parity, treating physical ailments different than we do mental ailments, and it's all part of the healthy body. So a big goal for the legislature this term is to improve the parity between mental health and physical health. I'll let Senator Lewis address his bill, which is fantastic, and I'll be signing on to with regards to our police and first responders. But the kind of holistic approach that we're going to be taking in the legislature is, again, to continue updating and changing the way we address substance use disorder, the way we address mental health itself, take away the criminalization of an illness, and really address the symptoms and get treatment for it, because a lot of the roots of the opioid problems come in self-medication. And so it's prevention, it's education, but it's also treatment and access. And so that's going to be a major focus of mine, and I know Senator Lewis and other colleagues, is improving access, improving services in the mental health sphere.
Absolutely, and it's the right thing to do for individuals and families, and also, a lot of our healthcare costs, obviously, as you well know, Alan, are going to the most complex cases, and very often it's people who have complex physical health challenges, chronic diseases, but also combined with some kind of mental health or addiction, and those are such complicated cases to manage. So if we can do a better job of preventing and treating the mental illness, we can reduce the rates of addiction. We can also, I think, then get a better handle on some of the chronic health conditions and healthcare costs. And then the other piece of this, which Mike alluded to, is the public safety side. We are seeing our first responders, our law enforcement, so often are the front lines in fighting this battle, because they're called into situations where somebody's having a crisis, and they can make the difference between life and death. How they respond to that. So we've seen some really good training that's out there, some in Massachusetts, some in other states. And one of the things that we want to do is make sure that training is accessible to every police department, and that ideally every officer is going to go through that, so that when they come into a situation where somebody is having a mental health breakdown or crisis or substance abuse, they can help hopefully de-escalate the situation, so the person in the end doesn't get arrested, but can hopefully get into treatment or whatever whatever they need, and nobody gets hurt as a result.
Well, I think what you're doing on the education front too is impressive. To me, over the years, as we've had more education on why you shouldn't smoke and more education on why you should try to be healthy in your blood pressure and those kinds of things, it's only in the last couple of years that we have had an awareness that the pharmaceutical industry has got some wonderful miracle cures, but also some things we have to worry about how we use the pharmaceuticals. And I have to say that even in the healthcare industry itself, there was not as much attention to that as there needed to be. And now the education is happening in the industry, but also the general public. That should help us.
Yeah, and that's one of the pieces that we mandated in that substance abuse law is for the first time, I think, requiring continuing education, specifically on opioids and painkillers, for our physicians and for our dentists and healthcare professionals.
And our medical schools and dental schools have really embraced that as well, which is good to see. They all want to be a part of the solution now.
Yeah, the classes went up, I forget the percentage, I had put it out on social media a while ago, but an extraordinary amount of classes that have been taken in the first year alone. The spike since that went in.
So that's hopefully that, and more will be more sensitive to prescribing practices, and also not prescribing 60 days worth when somebody only needs 3 days worth of a pain medication. All of these things, relatively simple steps, and we've done a lot of this through legislation. Some of it's through the healthcare industry, physicians stepping up. So it's really a partnership.
Well, that's great. We only have a few minutes left before we have to sign off till the next episode. There's so much to talk about. I really appreciate it. Let me bring it to some things I know you've talked about at the State House. We had the 75th anniversary of Pearl Harbor, a very emotional day in the State House. A lot of you, Senator Lewis, wrote about local heroes in the last month's worth of writings. And tell me how you have gone through the last month or so with the veterans and a very well-deserved recognition that's gone to the local heroes that you and I know so well.
Well, that to me is my inspiration in this job. I have to say, we're very lucky. We get to, interact with and meet and work with so many people in the community, and I call them unsung heroes, you know, and some of them are certainly veterans or spouses of veterans. Some of them are just students. Some of them are, I gave the example in this column you mentioned of a grandmother who's working with other grandparents who are raising their grandchildren because of the substance abuse problem. The children are taken away from their parents. So many challenging situations that people find themselves in or their neighbors in, and such a generous spirit you see, and most of the time nobody hardly even knows, and it's they don't get recognized. But that's really what gives me hope, even when we worry about what's happening in Washington and where our federal government is going. It's what we can do right in our own community and what we can hopefully do at the state level. That gives me my optimism.
There you go.
It's a huge perk of the job, frankly, to actually know who these unsung heroes are, because you find out, well, how did this come about? And they tell you, and then you find out, oh, it's a resident down the road who's been doing this quietly for a couple of years. It really is a thrill when you get that type of a situation. But on the veteran side, it's words don't do justice how meaningful it is to be able to welcome a veteran into the State House, show them around, tour them around. And I remember with Iwo Jima Day, earlier this year, we had a Stoneham resident came in who was an Iwo Jima veteran and didn't want any recognition, just wanted to come in and mark the day. And I was able to pull in under the arches, which you're not typically, a freshman certainly not allowed to do all that much. And the guards stopped. I said, I got an Iwo Jima veteran here. Get right over. I took the governor's spot for a couple minutes and was able to walk him in. And it was more of an honor for me.
That's great. That's great.
Really just a special day for me to be able to say thank you and honor him properly, which we never really can do. But it was really a special day for me to spend the day with him.
Well, that's the thing. You gentlemen are out there in the front lines, and we talk about all these issues that are so critical to the future of our region, and yet it comes down to personal stories so often, and you see so many, certainly on the campaign trail, but I know every single day of work. So we appreciate what you're doing, and appreciate you being here to let the community hear a little bit of what's happening. And I want to say that if we have a chance in the early part of the next legislative session, I'm sure that folks will want to hear again. But I want to say to those watching, great thanks to Senator Jason Lewis and Representative Michael Day for spending time with us. I really appreciate the input that you're letting us be part of.
Oh, thanks for giving us the opportunity, and Happy New Year.